afternoon, everybody. I'll be presenting my innovation in novel study on Timolol Maleate 0.5% eye drop as a potential agent for presbyopia correction. I am Dr. Parthasayatri Rai, Associate Professor, Department of Ophthalmology, Calcutta National Medical College. I have no financial interest in this presentation. In recent times, there has been interest among researchers to develop pharmacological agents to treat presbyopia. However, success to this aim is not overwhelming. Only pilocarpine 1.25% eye drop has been approved by US FDA till date. But there is some inherent problem of pilocarpine eye drop used in presbyopia, like compromised distant vision and narrowing of visual field. We hypothesize Timolol Maleate 0.5% eye drop to have such properties that it would be able to treat presbyopia, at the same time overcome the side effects of pilocarpine. Intrinsic tone of the ciliary muscle is maintained by mutually opposite interaction between parasympathetic and sympathetic innervation. The parasympathetic innervation tends to contract the ciliary muscle and the sympathetic tends to relax. Therefore, blocking the sympathetic innervation by instilling beta blocker drug like Timolol Maleate 0.5% drop will increase the tonic accommodation and therefore may be helpful in the treatment of presbyopia. This mechanism spares pupillary muscles, thus do not have any effect on pupillary diameter and also avoid side effects of multi-drug combination drops which are currently under investigation. Moreover, by use of Timolol Maleate, distant vision is not blurred. So our aim is to determine and compare the near point of accommodation and amplitude of accommodation of the subjects before and after instillation of Timolol Maleate 0.5% eye drop. Methods we employed is after Institutional Ethics Committee approval and for consent, we recruited 40 metropic subjects of ages between 35 and 45 years and randomly assigned them to binocular once only instillation of 1 drop of Timolol Maleate 0.5% eye drop, in intervention group 20 subjects, and in normal saline eye drop, which is control group, 20 subjects. For every subject, BCVA, IOP, near point of accommodation measured by Royal Air Force rule, and amplitude of accommodation calculated from NPA were noted prior to giving the drop and after drop half an hour interval for 10 hours. This is our result with near point of accommodation. The mean near point of accommodation is 24.95, which has reduced between 4 and 8 hours to about 19 millimeters. So 5 millimeter nearing of the near point of accommodation between 4 to 8 hours after installation of the drop. This tantamounts to about correction of 1.21 diopter of the amplitude of accommodation. Here you can see, soon after giving the drop, there is nearing of the near point of accommodation. It has started and there is stabilization between 4 to 8 hours, whereby it is reduced by about 5.79 millimeter. This is the mean value compared with the control. If we transform into amplitude of accommodation in the diopter value, then this is the result, and you can see the graph that it starts going up and we stabilize between 4 to 8 hours, by which time there was a correction of 1.21 diopter of presbyopia. So, near point of accommodation maintained a steady state between 4 to 8 hours of installation at points closer to eye by an average of 5.79 plus minus 2.87 centimeter. This tantamounts to presbyopia correction of plus 1.21 plus minus 0.42 diopter sustained for 4 hours between 4 and 8 hours after installation. There is no blurring of distant vision and no statistically significant lowering of IOP. So our conclusion is 1 drop of Timolol Maleate, 0.5% eye drop, instead binocularly can achieve correction of presbyopia to the extent of plus 1.21 diopter, sustained for 4 hours, between 4 and 8 hours after installation of drop. Thank you.
How do you propose this can be escalated? I mean, how do you feel that this can be used in future? Because 4 to 8 hours and just one diopter.
Okay, ma'am. Actually, this is the first time in the world that the study has been taken. The Timolol Maleate 0.5% has been tried for presbyopia. This is number one. Number two, I have just instilled 1 drop binocularly once only. This is the result. Now, I am getting 1.21 diopter of correction between 4 to 8 hours. Now, the next aim, my next aim will be, it will increase the duration of action by just putting a top-up drop, say at the end of 5 years, 5 hours. Then it will maintain for another 4 hours. This is to be proved by study, but this is number one. And as it is now, for transient use, see, for sewing, household sewing, cooking, and reading this type of conference, for 4 hours, you can use as it lies now. And next thing that we can add it up to pilocarpine. Then we can use this as a constant for long-term use.
Yes, so thank you. No doubt it is useful, but I would say that comparing the cost of the drug, side effects, and using this drug for only transient, so will it be any helpful to the patient for correcting for only a few hours of presbyopia?
Actually, we took in the exclusion criteria, we exclude the cases of diabetic with the other COPD, the heart block, the asthma patients, we excluded. So there is no safety issue, at least in this study.
Correct.
So do you, feel that patients who are already using Timolol Maleate for glaucoma, they will not develop presbyopia?
Actually, nobody bothered to investigate it.
Can you?
If you investigate it, maybe that somebody getting, and my hypothesis is based on, is a pharmacological basis. No? Pharmacological basis, the hypothesis is there.
Thank you very much.
Okay, thank you very much.
Okay.